Hi, everyone. So I am Sarah, and I am in my second year in the clinical mental health counseling program. And today I am going to be sharing with you how self care can not only be a prevention tool for burnout, but it can also be a very supportive tool for us as practicing clinicians in the near future to use in order to help us not feel burned out in our field. So, first thing I want to share with you guys is what exactly is self-care? And essentially self-care, it's the practicing of behaviors that do promote some well-being as well as they counter the work-related stress among various helping professions. And when I say helping professions, not only do I include ourselves as therapists, a lot of nurses and doctors practice this too. And self care can be used for a wide variety of professions, specifically helping professions. But with self care, because we're practicing these behaviors to not only promote well being, but we also use it in contrast to the work related stress that we could sometimes experience. So, for example, some work related stress within counseling, it could be a client tries to attempt suicide. It could be that a client is hospitalized for severe illnesses. It could be you get cussed out by a client. Those are some very stressful interactions you can have while you are practicing therapy that can, of course, be stressful. And of course, with self care, we want to promote this well being. And essentially, promoting well being, when we further look into it, it's so that we can ensure that our fundamental needs as a person they are met and we enable our own ability to respond to conflict, overcome challenges, and cope more effectively with stress. So the way that self-care is a very strong prevention is just like we talked about this work-related stress. It can come across with conflict, challenges, and how we effectively manage the stress of being therapists and being in the helping profession. We can ensure that taking care of ourselves, we can take care of other people too, which is something I will discuss even further in the next slide. But overall, with self care being a preventative tool, this essentially will help us to be very proactive and very intentional. And being proactive and intentional can also promote resiliency. And resiliency, what that means is we use adaptive abilities to withstand different adversities and different, stresses that go on within our helping professions. And resiliency, you can continue to strengthen that skill. And self care is a skill that you can continually strengthen too, but you can only strengthen it unless you practice it. So when we continue to be resilient, we can pretty much push down those barriers that can sometimes prevent us from handling stress at work very appropriately. And when I say appropriately, sometimes we can encounter very difficult situations that maybe we don't know how to handle. And the more and more we get comfortable with ourselves in that position, the more resilient we could be. And what's super interesting is there could be several influences that can influence our self care. And there's this study that was conducted specifically for nurses as well as therapists because they were finding that nurses and therapists had a lot of similarities determining why they practice self care. And essentially, as I will explain shortly, caring for yourself in order to care for others. So, studies have shown that demographics do influence one's own capabilities to practice self care. And a specific study that I found for both nurses and therapists, they found that individuals who were living in an urban area were advancing in age, so a little bit of the older age demographic. They had a separated marital status, and this study included those who were single or those who were separated and divorced were part of that category as well. And another piece of this is those who do not have a high school education. Now, these pieces all are associated with the negative responses to self-care. So essentially what this study found is those who live in an urban area are the older age demographic. have a separated or single or divorced marital status, or do not have a high school education, they tend to have more negative responses to self-care. And the reason why that these negative responses are quite a bit more prominent within these influences discussed is because when you think about it, living in an urban area, typically that can be very exciting and thrilling to be around a lot of people and a lot of places in one kind of condensed area, like Chicago, Los Angeles, New York City, places like that. And sometimes you could try to find connections with people, but there's so many people, it's hard to have those intimate connections with just a few people, typically. And then those who are advancing in age, there is this mindset that the study had talked about where I don't feel like I need to make friends. I'm too old to make friends. I'm fine being by myself. That was definitely the mindset that those advancing in age were holding for these negative responses, which in turn related very honestly back to this separated, single, divorced marital status, because these people, quite frankly, they're lonely. They don't have a partnership, and they don't have a partner to confide in or to share their struggles that could be going on at work, because typically you spend 5 days a week at work, 8 sometimes ish hours a day at work. It's pretty common. And then the other piece is those people who do not have a high school education could develop very negative responses to self-care. And the study dived even deeper into this dilemma, and essentially it is because those who do not have any high school education tend to have a very hard time finding very stable and very sufficient jobs. So these jobs that they work, more times than not, are not very fulfilling either. And that can be very hard on someone too, that they want to have a fulfilling life with a fulfilling job, but it's hard to do that nowadays with no high school education, unfortunately. So this study really showed that these influences that could create these negative responses for this specific demographic, it shows that there is an importance and desirability of and ability to perform these self-care behaviors for us as clinicians, knowing that there are things that we must prioritize in order to practice self-care. So given from these influences we had, let's go back to the separated marital status and the fact that a lot of those people are lonely. They don't have someone they go home to, or they don't have a partnership that they could confide in the hardships going on at work, quite frankly. And these people that are lonely, it's hard for them to want to practice self-care because they don't have anybody else to really talk about what's going on for them. And loneliness can definitely make an impact on someone really wanting to take care of themselves in order to take care of other people too. So this slide, you can see, it's called Care for Others, Care for Yourself, which I have already mentioned a few times. And I thought this was a very powerful way to explain to people that in order to actually take care of others, which essentially as therapists, you're taking care of others in a sense, you have to take care of yourself too. And it's the same idea that you have to practice what you preach. You tell a client you need to practice self-care 3 times a week, and you're not doing it for yourself, how can you expect your client to truly take care of themselves if you can't even do it yourself? So engaging in self-care behaviors, it goes across the physical, psychological, emotional, spiritual, relational, and workplace domains. So self-care, quite frankly, we have so many domains covered on just the slide that it's going to encompass several areas of your own life. And the big goal of practicing self-care is you're wanting to promote longevity, retention, and resilience. And these 3 pieces right here are definitely positives in wanting to take care of yourself in order to take care of others. So some examples that I have listed, they all relate back to the physical, psychological, emotional, spiritual, relational, and workplace domains. And that includes meditation, journaling, grabbing coffee with a friend, regular exercise routine, completing puzzles, and praying. These are all very exceptional examples of how you can practice self-care. And a point that I want to mention that the articles I was reading really were sticking about regarding how to practice self-care. They say you need to be able to take care of yourself in a sense that you can't take care of others, but you need to make sure that you're not being greedy with the way you take care of yourself. So what this means is, taking care of yourself, it could mean meditating, journaling, grabbing coffee with a friend, but it shouldn't mean that I am going to go to the hair salon once a week just to get my hair cut and colored, or I am going to get my nails done once a week and get a new color every single week, because those essentially are considered greedy ways of taking care of yourself. And those are also considered very surface level ways of taking care of yourself. And quite frankly, there are times where you're going to want to do that, or you're going to have to do that in order to take care of yourself. But doing that consistently is just not very beneficial, essentially. So this last piece I want to share, it's called The Ode to Self-Care. And it is authored by it's a practicing cognitive behavioral therapist. Her name is Sandra Wertzke. She has her doctorate in CBT and clinical psychology. And she actually created this poem, and it talks about how to practice self-care and why it's such an integral part as us clinicians who are in training, and how we can continue to use it over and over again. So I am going to share with you this poem. We are going to look over this real quick, because I think this is a very important as well as creative outlet to express how we need to take care of ourselves. And not only do we take care of ourselves on a daily basis, but we need to do it on a weekly basis and even monthly basis too. Alrighty. So it says, the hours are varied and intense, issues weighty and immense. Being a therapist has such meaningful intent, with bi-directional impact which is significant. I need to keep attuned to my own self-care. It's not only required and ethical, it's vital and fair. Helping a young adult keep his depression at bay, encouraging a young woman to say what she needs to say, strategizing about how to eat more without guilt, deconstructing the emotional walls that we've built, role-playing with the teen on coming out to her mom, coaching a belligerent dad on keeping us calm, managing intense suicidal intent, sorting through an ex's messages to understand what they meant, uncovering a strange, confusing symptom ruse, discovering yet disclosed child sexual abuse, coaching a parent on managing her aggressive teen, building skills with the child whose peers are belittling and mean, guiding someone whose OCD overpowers, gently encouraging someone who hides and cowers, helping to settle dangerous, impulsive urges, aiding and allowing more emotional surges, processing through old relational abuse and neglect, uncovering how a recent tragedy did affect. The issues all have effect and take hold, requiring me to be connected, gentle, and bold. Even after notes are done, thoughts still swirl, potential ways to respond more effectively unfurl. Those are the times I need to unwind, finding ways to soothe my body and mind. Like a cell phone needing to be recharged, I need rejuvenation time enlarged. Like a massage therapist who can only manage so many clients per day, putting limits on psychological needs per week is also okay. Practicing what I preach cannot be scoffed. I deserve good boundaries and I need time off. Sharing this declaration openly feels vulnerable and daring, but this ode represents accountability for working more on self-caring. Making shifts start with baby steps, just a few, as change ideas are simple to say, but hard to do. Thank you for listening and staying attuned to the end, and for maybe also reflecting on what you, too, might want to mend. The last piece I would like to leave everybody with is think of some ways that you can practice self-care on a daily basis, on a weekly basis, and on a monthly basis. For example, on a daily basis, I personally read my Bible every night before I go to sleep. and that's a big part of my self-care on a daily basis. On a weekly basis, I take a nice hot bubble bath Friday after I come home from work before the weekend gets started. And once a month, I try to grab lunch with a friend, grab coffee with a friend. And that's a way that I utilize self-care in order to take care of myself so I can care for others. So I encourage everyone to keep thinking about how they can continue to practice self-care on a daily basis, weekly basis, and monthly